and welcome to Folate Feud! Tonight we have a head-to-head battle between two teams of clinical nurse leaders. On this side we have Team Vitamin M with Jearelly and Cherelene. And on this side we have Team B9 with Stephanie and Jennifer. Let's get started. Question 1. The U.S. Preventative Services Task Force recommends folic acid supplementation for which population and for what reason?
It's probably women of childbearing age, which we typically think of as women between 18 and 44 because they're at most risk for folic acid deficiency.
I know the recommendation states that folic acid should be taken at least 1 month before conception and continued through the 2nd or 3rd month of pregnancy.
Okay, so we're going to say women of childbearing age to prevent neural tube defects.
Survey says that is correct. The USPSTF recommends 0.4 to 0.8 milligrams of folic acid supplementation daily be implemented in all women planning or capable of pregnancy. All right, question number 2. What evidence has been found that folic acid supplementation reduces morbidity and mortality?
I remember that a 2010 Cochrane review of 5 trials looked at use of folic acid supplements in prevention of neural tube defects and found a significant protective effect. Even when compared to placebo, no folic acid or other supplements that didn't include folic acid.
And most importantly, a randomized double-blind prevention trial conducted by the UK's Medical Research Council found that folic acid supplementation in pregnancy reduced neural tube defects by 72%.
Survey says that is correct. Next question. Question number 3. The March of Dimes Birth Defects Foundation recently examined awareness and adherence to intake of folic acid among approximately 2,000 18 to 44-year-old women. While the majority of women had heard or read about folic acid, what percentage reported knowledge of the importance of taking folic acid prior to becoming pregnant?
50%?
Yeah, I think it's 50%. Final answer.
Survey says that is wrong. Let's bring it on over to Team Vitamin M. What do you all think?
There is no doubt in my mind that the answer is 7%. Final answer.
Yes, according to the study, only 7% of women knew folic acid should be taken before pregnancy, and 31% of these non-pregnant women reported taking folic acid daily. All right, question number 4. Name 3 health disparities in adherence to the recommendation for folic acid among women 18 to 44.
I know this one. Non-white women, women with less than a high school education, and those with a household income of less than $25,000.
Survey says that is correct. In addition to the ones you listed, women's age 18 to 24 are also less likely to be aware of or adhere to folic acid supplements. Question number 5. What are some of the risks and controversies of folic acid supplementation?
We're going to say there are theoretical risks such as possibility of masking, vitamin B12 deficiency, drug interactions, allergic reactions, carcinogenic effects, and increased twinning.
Also, I think the dose itself is controversial.
Survey says you are correct. The dosage is controversial for many of the reasons you mentioned. The recommendation for 0.4 milligrams has been shown to prevent a majority of neural tube defects, but it's not perfect. And some think the dose should be a lot higher. Question number 6. What are some barriers to meeting the recommendation for folic acid?
Based on data gathered by the CDC, only 7.2% of providers prescribe folic acid or multivitamin supplements to women of childbearing age who are being seen for preventative visits.
And additionally, many providers don't even know the proper dosage recommendations. A study of the community pharmacists found that only 63% of pharmacists knew the recommended dosage for women of childbearing age.
That's right.
Survey says that's right. Other reasons include women forget to take them or simply don't feel like they need them. Question number 7. This one is a bonus question for double the points. Apply a specific theory to explain risk factors for low adherence to folic acid supplementation.
We're going to go with the health belief model.
Okay. Now for full points, name a risk factor for each construct.
All right, perceived susceptibility. Women who have had a prior pregnancy often cite anecdotal experiences as reasons for not taking folic acid. Like, I didn't take folic acid with my first pregnancy and my baby turned out fine. Also, women who aren't planning pregnancy don't think they need to take it, but 50% of pregnancies are unplanned.
And there's perceived severity. A lot of women have heard that they need to take folic acid, but they don't really know why they need to take it. In other words, they haven't heard about the devastating effects of neural tube defects. And perceived barriers. Well, the reason women mostly cite for not taking their vitamins is that they forget to take them. It's pretty simple. Women have a lot of demands, and they might see this as just one more thing added to their to-do list. Another barrier, of course, is the smell, taste, or size of folic acid supplements, which can deter women from taking them daily.
Correct. Question 8. Okay, for this next question, your answer must incorporate the model that was just described. What evidence-based strategies can a CNL use to increase adherence to folic acid supplementation?
Well, a major review of all the kinds of interventions show that although many of the interventions have been shown to increase awareness, adherence hasn't necessarily increased. Most of the time, it's still below 25%. The interventions they reviewed covered a broad range of methods: TV, newspapers, radio ads, magnet reminders, community education classes, websites, food labels, and more. Increasing awareness can help women understand the perceived benefits, but it doesn't necessarily move them to action.
Still, there are certainly CNL strategies that help. One intervention combined physician counseling, a reminder phone call 2 weeks later from a nurse, and a starter bottle of folic acid tablets. That's your cue to action and self-efficacy right there, all rolled into one. They found that the group that got the nurse's reminder call and the starter bottle of pills in addition to counseling significantly increased their use of folic acid. They were actually closer to 40% using folic acid daily.
That is correct. Question number 9. Again, using the health belief model, describe some effective strategies that a CNL can use to influence the healthcare system and healthcare providers to increase delivery of screening recommendations.
Simply emphasizing the need for folic acid supplementation is not sufficient. We know that non-white women, women with lower SES, and women with lower levels of education are more at risk. As CNLs, we can educate other healthcare providers not only to screen for folic acid use, but also to focus on these at-risk demographics.
And CNLs can also help by creating PSAs, or culturally specific literature, to reach these women. A group at the University of South Florida has developed video novelas and other materials for Hispanic women, which have shown a lot of promise. It's mostly like, for our efforts to be effective, there would have to be a combination of interventions, support from healthcare providers, media attention, other creative strategies.
All these actions would help clarify the positive effects to be expected from folic acid supplementation, which follows the health belief model in providing perceived benefits. And the PSAs and culturally specific literature can help correct any misinformation, which again follows the health belief model by addressing perceived barriers.
Survey says, good job, ladies. These are all ways a CNL could increase the delivery of screening recommendations. Final question. All right, it is now time for our sudden death round, social and health policy. What are some policy implications for enhancing this evidence-based screening?
Well, following the initial recommendations in 1992, a major public health campaign and education and media efforts aimed to raise awareness and increase supplement use. But it soon became clear that this wasn't going to be enough.
Yes, because following this, in 1996, the FDA started requiring that enriched grains, things like flour, bread, and pasta, be fortified with folic acid.
And of course, the CDC, American Academy of Pediatrics, and March of Dimes lobbied for a much higher level than the FDA required. But the policy still made a big difference. Enforced fortification in several essential foods allowed modest increases in folic acid levels in the general population, including women ages 18 to 44. From 1996 to 2004, the CDC recorded that there was a 25% decrease in neural tube defects.
And another implication for health policy concerns contraceptive pills. It's been estimated that if all contraceptive pills contain folic acid, the number of neural tube defects would fall by an additional 24 to 31%.
Excellent job, ladies. That is correct. All right, great job, everyone. And for our prizes, everyone in the audience gets a bottle of folic acid. That means you, and you, and you. And that's our show for today. Tune in next week for